And at the start of the pandemic, quarantine and isolation were a major part of preventing COVID from spreading. Now the CDC making some changes to those guidelines. So here with us now, Dr. Ali Raja. So the CDC, as we know, reducing quarantine time to 5 days if a person's asymptomatic. That's down from 10 days. Doctor, what do you make of this recommendation? Why did the CDC make this change?
Well, Michelle, I think it makes some sense, but I've got to tell you, there's parts of it that are still making me a little bit worried. I get that 5 days makes sense because we know that the Omicron data shows that if you're vaccinated, you're not infectious for probably 3 or 4 days after you start developing symptoms. And so having 5 days after and being symptom-free makes sense. Ideally, though, we would also have a follow-up rapid test that's negative before patients or people came out of isolation. The problem we're running into is, I don't know if you've tried looking, but it is really hard to find rapid tests. And so making that part of the requirement just isn't feasible, even though it's really the right thing to do.
Wow. Well, unfortunately, looks like COVID is here a lot longer, than we had anticipated. Are these new guidelines evidence that we're learning how to better live with it, or is there maybe an economic motivation behind this new change?
I think you've hit the nail on the head. It's actually probably both. It's number one that we know how to live with it. We have protocols in place at hospitals and other places of work where people know that they should wear masks and they should stay home when they're feeling ill. But it's also just the economic reality that a 10-day isolation period just isn't feasible for a lot of people. And economically, it's really hard on the people who are affected, and it's really hard on the greater economy as a whole because we just can't have people go out for 10+ days at a time.
Do these shorter isolation periods mean that there's a shorter recovery time, or is it more about the period of time to where you can infect another person?
It's more about the period of time during which people who are positive are able to infect others, exactly like you said. We don't know enough yet about the longer term ramifications. We're just still learning about long COVID and the effect that it takes. And we definitely don't know what the Omicron variant will do in terms of patients who have long COVID.
We want to switch to another measure that can help prevent the spread of coronavirus, and that's masks and the mandates. Doctors now encouraging people maybe to switch away from cloth masks and use disposable or N95 masks. What is your recommendation when it comes to face coverings?
We've really seen the science behind masks change a lot over the past couple of years. And if you'll remember, we didn't quite know what would and wouldn't be effective when the pandemic first started a couple of years ago. And then even on top of that, we didn't have enough masks. The cloth masks were really a stopgap when we didn't have enough surgical masks, those blue masks that everybody's wearing. Now that the supply chain is actually built up, they're really much more effective than the cloth masks, which can really vary in terms of just how much protection they provide.
What about social distancing? That's one we don't really hear much about anymore. And at the beginning of the pandemic, it was all about give me my 6 feet, right?
It definitely was. And, it really still is, especially when we're talking about being indoors. Now, fortunately, over the past many months, right, most of this year, it's been warm enough to be outside and we've been able to do a lot of activities outside. But now, at least here in New England, here in Boston, it's too cold to be outside. And so when you're indoors, it's really important not only to mask, but to stay in a well-ventilated spot and also to maintain that 6 feet. It's still really important.
We are in the midst, I would say, of a surge, right? Is expected to possibly get worse after we get done with the holidays. When do we anticipate that things could possibly die down?
Well, the data coming from South Africa, where that's not where this Omicron variant began, but they were the ones who were kind enough to first tell the world about it. It shows that they've actually started coming down from their peak, and so I and a bunch of other people are really hopeful that we'll see this peak come down in January as well. Now, that doesn't tell us much about the next variant, which might develop anywhere in the world, but hopefully this Omicron peak will start coming down in the next few weeks.
All right. When it comes to getting people vaccinated, what do we need to do to get people more vaccinated, which could possibly help with the spread of coronavirus?
Well, I think we're learning a lot about why people aren't getting vaccinated, Michelle. The fact is that there is this core group of people who just don't believe that the vaccines work. And I'll tell you, in my emergency department, when I see patients, I still run into them and I still I think I make a pretty good effort to try to convince them, but It's a little half-hearted at this time because I've lost that battle so many times. But for a lot of other people, it's I couldn't get time off of work to go get vaccinated, or there wasn't a vaccination location open near me. And when those patients come into my emergency department and actually say, look, you're here for your sprained ankle because you slipped on the ice, but I've got all this vaccine and it's just going to go bad. Let me go ahead and give it to you. They actually take me up on it, not because they don't believe in it, but just because they've been too busy with life to actually get it done. So I think making it more easily accessible to that large group of people who aren't vaccinated, not because they refuse, but just because they haven't had the chance, I think that's where we need to be.
All right. We appreciate your time and your insight, Dr. Ali Raja. Thank you so much, and Happy New Year to you. President Biden now ordering the use of FEMA funding to meet COVID testing demands. State and local health departments will receive money to run testing sites from the Department of Health and Human Services. The Omicron variant has caused a surge in people wanting to get tested for the virus. Next month, President Biden will start sending out home test kits to anyone who requests one online. Some travel experts worrying that flight cancellation chaos could extend now through New Year's Eve. Jen Sullivan has a look at what benefits you could receive if you find yourself stranded at the airport.